I'm Dr. Keith Ryan, a chiropractor in Tulsa, Oklahoma. I wanted to talk to you about neck pain that's radiating down the shoulder. So what I'm really talking about is pain here in your neck, and that's the cause of it. But a lot of times you'll feel it just completely coming down your shoulder and sometimes down your arm. And it can stop at your elbow or it can come all the way down. And ordinarily when it comes down, you'll feel it either in these 3 fingers or these 2 fingers, depending on which nerve root in your neck is irritated. These 3 will come from the medial nerve. These 3 will come from the ulnar nerve. And ordinarily when I see patients with radiating pain down the arm, doctors call pain that comes from somewhere else. So instance, from your neck, and then it goes down your arm, they'll call that radiating. So ordinarily when I see patients with radiating pain, it'll hurt a lot, sometimes just in their arm, and sometimes their neck will hurt, but not very much. And sometimes their neck won't hurt at all. And some people have a hard time with saying, well, you know, my arm hurts, and realizing that the problem isn't in the arm, and that it's actually in the neck. And you have to understand how the nervous system works for that. You know, you have your brain in your head, the spinal cord comes down off of that. The spinal cord is really an extension of your brain. And then off of the spinal cord, coming out between the vertebrae, is nerve roots. So the nerve roots that are coming down through your arm come out of your cervical spine and part of your thoracic spine sometimes, and come down through the shoulder and down through the arm, and they innervate that. So when you pinch a nerve in your neck, the vertebrae out of alignment, pinching a nerve, that will cause the pain to come down the arm. And depending on which side you do it on, will be which arm it'll hurt. If it's pinched on the right, it's going to be the right side. If it's pinched on the left, it's going to be the left arm across there. So it can depend on that. I mean, sometimes you can get both of them pinched, and it'll come down both arms, which is really uncomfortable. But you can have that happen depending on how the vertebrae is moved and out of place. So how we correct that is by chiropractically is by aligning the spine. So we'll have a vertebrae out of alignment, pinching a nerve. We'll correct the alignment of the spine, get rid of the inflammation, and the arm pain goes away virtually almost every time. I mean, you can have a ruptured disc that's pinching the nerve and have it so severe that it won't get better, and then that particular time you'll need surgery. But as I've seen patients, very seldom has my patients been able to have surgery. We've been able to virtually almost every one of them, with a few exceptions, correct it, and the patient just goes down the road with a series of exercises, and exercises that they'll have to continue to do, because their neck's probably weak in the first place for all this sort of thing to happen in the injury. And so we'll have them strengthen their neck, we'll have them learn a bunch of stretches across there, we'll keep the neck in alignment, and it works fabulously for trying to correct the problem. Hope this explained a little bit to your symptom of neck pain radiating down the arm. Thank you very much.